Hi, my name is Leshem. I'm a dermatologist and the director of the Atopic Dermatitis Clinic at Rabin Medical Center in Tel Aviv University in Israel. I'm happy to present the Harmonizing Outcome Measures for Eczema, or HOME, implementation roadmap on behalf of my co-authors and the HOME initiative. Anyone who's ever conducted a systematic review and meta-analysis has probably found themselves unable to combine or compare results because studies often measure very different outcomes or report them differently. Core outcome sets aim to address these issues. Core outcome sets are standardized minimal sets of outcomes that should be measured and reported in all clinical trials in a health field. If all studies use the same core outcomes, we can improve outcome reporting and support systematic reviews and meta-analyses. HOME developed a core outcome set for clinical trials in atopic dermatitis. However, it's become clear that getting clinical trialists to actually use it is very challenging. To guide our efforts to increase the HOME core outcome set uptake into trials, we developed the HOME implementation roadmap. Development was based on a review of the scientific literature and online resources, input from HOME members from 2 international meetings, and the HOME Executive Committee's experience in core outcome set development and in clinical trials. The HOME implementation roadmap shown here follows 3 stages. Note that implementation doesn't start after the core outcome set is fully developed, but rather right at the onset of development. The first step is defining the core outcome set scope and committing to uptake goals, which will later be applied as progress benchmarks. During core outcome set development, we prepare for future implementation by making sure the core outcome set is established as a credible and an evidence-informed consensus. For example, by using robust development methodology, by engaging multiple stakeholders, most importantly patients, and by designing a core outcome set that is easy to use and applicable to different populations. After the core outcome set is developed, we aim to incorporate it into trials and reviews. This is a complex, iterative process, going through cycles of gathering data on uptake, which is used for designing and then carrying out targeted implementation projects, reassessing our success against the predefined benchmarks, adjusting our implementation strategies, and the cycle repeats. In summary, the HOME implementation roadmap is a starting point for a structured approach to core outcome set implementation, which can complement the formal use of implementation frameworks. This roadmap can help fulfill the purpose of core outcome sets, the consistent use of relevant outcomes in clinical studies to ultimately support patient care. On behalf of myself and the research team, we thank you for your attention.